Yeah, fine.
Hello, everyone. Good afternoon, everybody. I'm Priyanjali from the Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we have with us the well known Dr. Krishna Karthik from Hyderabad. Dr. Krishna Karthik, MBBS, MS, and MCH, is a gold medalist and senior urologist at the Urology, Andrology, Diabetology, and Sexual Wellness Clinic in Hyderabad. He has a rich experience in the field of urology, andrology, and is a reconstructive and transplant surgeon. He has performed various critical surgeries and treated his patients with utmost care. Today, Dr. Krishna will talk on a very important topic, which is overactive bladder and its management. Overactive bladder is also called as OAB and is a condition of the bladder which causes sudden need to urinate that may be difficult to control. OAB increases with age and is more prevalent in women than in men. This condition is common and distressing and may have a large impact on the quality of life of the patients. So let us hear more on the management of OAB from Dr. Krishna himself. Over to you, sir. The first question is, how do we define OAB?
First of all, let me say that, see, as rightly told, madam, that OAB is overactive bladder. So, the reason for overactive bladder is to be understood in a sense, saying that the overactive bladder must never be troublesome. Simply saying, if you go more urination, so it will be the disturbance will be there in your work in the morning times, and disturbance of the sleep in the night times. So disturbance of the night times sleep will cause the rhythm changes, and so on and so forth, and then the OAB increases. So for the to define the overactive bladder, normally a person will go somewhere around 8 times urination per whole day. That means in 24 hours, you go for an 8 hours time, 8 hourly, or that means 8 times. That means third hourly you go to the urination. So this can be divided into 6 times in the morning and equal to less than or equal to 2 times in the night. If you go more than 2 times in the night, then it will be practically troublesome and you will have a disturbed sleep. Now, so that we this is the simple definition, and every 3 hourly urination is practically normal. Now, so when this comes to overactive bladder, the treatment management, before going to the treatment management and all, we need to find out the reason for OAB. So the practicality lies in why the bladder is becoming overactive. See, the bladder has only two functions. The first one is to store. The second function is to throw away the urination. That is called voiding or micturition. So when it comes to storing urine, the kidneys are constantly producing urine according to the intake and up to the function of the kidneys, and then that is slowly trickling down into the bladder, and bladder is slowly enlarging. So the normal capacity of the bladder, depending upon the age, in children it is low, and in adults and adolescents, it's the storage capacity somewhere on stands up to 350 to 400 or 5 up to 500 ml. We can store the urine. Once the urine is stored to 4 500 ml, then the firing comes from the brain saying that yes, bhai, that your bladder is full now, you have to go and empty or void the urine. So this is normal, and the mediator in between is the spinal cord. So if you understand this particular phenomenon, it is very easy to explain the overactive bladder. So the in general and easy to understand, the storage function of the bladder is with the help of the spinal column or the neural network from the spinal column, and the voiding phenomenon and the firing comes from the brain, which intermediates or which stays up in the which fires up to the spinal cord and then to the bladder. So we can
Right,
explain this particular phenomenon.
right. So, doctor, what can be the general cause behind it?
Yeah. So the most common causes, there are multiple causes though, madam. Like you told me, like आपने पहले जिक्र किया था कि हाँ भाई, it happens in children, adults, women, and as you age. But there are multiple reasons for the overactive bladder. The first among, let us discuss the reasons becoming, for example, in case of infections, Okay, particularly in diabetics, in case of urinary tract infections or those infections which go undetected, they become recurrent UTIs, and sometimes the bladder goes into hyperactive bladder. Okay, and next comes to there is, if there is any intervention and there is a stricture of the urethra, that means that the urinary pipe is blocked and bladder is trying to throw away, but urine is getting remnant. Jo bach raha hai, that is getting infected, and bladder wants to throw it away. And so the infection causes, one is infection and the other is the bladder muscle overactivity. And in some patients, like in the patients with CVA or brain strokes, what happens is that the brain is inappropriately firing, or it is unable to tell the spinal column to void the bladder. So bladder will take a turn, or the bladder muscle will try to overact the signals. So in those cases also patient may have overactive bladder. And the simplicity of overactive bladder can also be termed factitious. Like some patients do drink more water and do avoid more. So that need not be termed as overactive bladder unless we investigate the patient and has an appropriate history with the appropriate examination also. So, and most common causes are, like I told you, like comorbidities, infections, and some anatomical anomalies of it. Or in adults, males, there can be a prostate obstruction. So these are the generalized causes for overactive bladder.
Right. Now, doctor, now that we know the causes, identifying the condition on the initial stage becomes a very challenging thing for all of us. So, how do we know in the initial stage that now it is the time to visit the urologist? What are the early symptoms of it?
Yes. See, for example, ma'am, like I told you, every person voids third hourly, and per 24 hours, you must pass around eight times. Not more than two times in the night. That becomes troublesome. So more than eight times in the mornings and more than two times in the night, or urination which is disturbing your routine works. So these are the things which are symptoms to go to the urologist. And also saying that night urination is the real troublesome thing, especially for elderly gentlemen. After 50s, usually the increase in the size of the prostate accounts to many, along with the strictures, along with some infections. And in case of females, those who are perimenopausal or postmenopausal women, because of the hormonal lack or the supports to the urethra or lost or their lax. So in those scenarios also, sometimes we might find this particular thing associated. Overactive bladder, and overactive bladder is usually associated with some incontinence too. This must be a point to be noted. For example, patients often do say that, sir, my urination, I am unable to hold the urination, I am running and running. So in female, we need to know that there is something called as urge incontinence and stress incontinence. So they are often associated with OAB. Stress incontinence means if a female sneezes or coughs, or in a worse scenario, if she sleeps and she wakes up and then she tries to leak out the urine. So this is called SUI, stress urinary incontinence. And urge incontinence is something where you have an urgency and you have an urge to pass, but you cannot hold the urination. So these are all the things to be incorporated in a diagnosis of OAB. We have to differentiate and then give a appropriate nomenclature and then treat the patient.
Right. Now, doctor, what is the first line of diagnosis when a patient comes to us?
The first line of diagnosis is as simple as that. Patient himself will say that, sir, I'm unable to control the urination and I'm going so many times that I'm getting disturbed, be it sleep or be it work. So in these scenarios, we try to think of what is the underlying cause. So we examine the patient, we ask him, sir, is there any associated comorbidities like hypertension, diabetes, or any instrumentation of the urethra, or previous surgeries, or pelvic surgeries, or any associated surgeries like cancer surgeries, or any intestinal issues. So all these things needed to be taken care of.
Right. And what are the treatments which are currently available to treat the patients with OAB?
Yes, very good question, as ma'am. In the treatment coming, when you come to the treatment phenomenon, we know now that the overactive bladder causes the quality of life loss of
Hmm.
quality. So we quantitate in terms of qualis, QUALYS, and DALYs, DALYS. So daily loss of and quality loss of life. So in these issues, the quality of life is lost usually in the elderly people, and also in recurrent UTIs in younger generation, younger people also with the recurrent UTIs. So these needs to be addressed very well, and in it must be tailored up to the patient. If you ask me, the questionnaire or of a OAB must be it fits up to the patient, and it is up to the tailored patient. For example, if it is a patient with a prostate, his questionnaire will be different. If it's the patient is with cancer post chemoradiotherapy, the questionnaire will be different. But and if the patient is with instrumentation or a stricture urethra, things might go different. But the common scenario is that the questionnaire needs to be asked is all about urgency, the symptoms, incontinence, how many times and how much loss he is having because of this particular urination, and how much work is getting disturbed and sleep is getting disturbed because of this particular thing.
Right, right. Doctor, moving ahead, uh, can this be prevented? Now, everybody might be wondering that we are just listening about the problems, the condition, the kind of symptoms. But as we know, age is one of the biggest factor here. So here, the scenario becomes a little dicey for us. So can we say that it can be cured completely?
Yeah, it depends on the scenario. See, for example, if a patient with prostate comes, if it is an early
Hmm,
disease or a late one with an obstruction causing obstruction to the bladder neck, and we relieve the obstruction, either be it because of surgery or be it because of drugs, yes, the patient can be treated. And along with this, the important question goes, or there is an entity called bladder diary. This needs to be entertained very well with every OAB patient. The bladder diary tells us about the total intake per day and the total output per day, and how many times the patient is passing urine. So this can be calibrated, and the patient can be helped by asking him to by reducing the content of water or increasing the content of water according to the bladder diary.
right.
And we can
Now,
train the patient too.
right, right. Doctor, now because we are focusing on hydration a lot here. So, what is the general way of having water? How much water should one intake? And we know a lot of people who has a limit of intaking water. Suppose 3 liters of water every day they should intake. And I know people who intakes 1 liter at one go. So, the correct way of having water, and how much water to exactly have, also the timing, which time should they normally avoid drinking water?
See, the consensus, or actually, there is no consensus written anywhere that you must have this much amount of water. But in general, the body metabolism says that how much our output comes per day, approximate output per day is 1.5 liter, and for that we add miscellaneous losses. So, on an average of 2.5 liters per day will suffice for a normal person. But if the person is an athlete, or if the person is working in heavy sun, or a laborer, a bit of more water will also do. But this notion of taking 4, 5, 6 liters of water per day, usually patients or people do get adjusted with the amount of water they intake,
Mm,
and they feel comfortable in that way. For example, some
mm,
persons say that, sir, I wake up in the morning, I just have some 1 liter or 2 liters in a go, then my bowels will be very clear. And
mm,
some persons do say that, sir, I every time I go to washroom and I just want to hydrate myself and I'll have a lot of water. So it is up to the patient's comfy or comfort. But the
mm.
total intake per day must be somewhere around 2.5 liters per day. But
Right.
in scenarios or in persons with the kidney diseases, we usually we usually we usually reduce the amount of liquid intake also. We calibrate it to
Mm,
input being equivalent to output in kidney disease patients with the increased creatinine levels.
Right, right. Now, uh, speaking about hydration, there are specific diets focusing just on hydration. So, we have heard of water diet nowadays. People get to see a lot of change in their body. They say the weight can fall drastically within 1 or 2 days if the person is just on water. Not water exactly, any sort of liquid, healthy liquid. So,
So,
can those things be harmful for us?
That's a very good question asked. See, these are practically fancy things. Okay.
Mm,
And I'm no fancy guy to be spoken of. So,
yeah.
in these fancy things, see, it is up to the body metabolism. That's what I say, madam. For example, if you go on a diet, if the diet is proper, with the proper
Mm,
intake of carbs, fatty acids, and then oil, everything going in a appropriate fashion, things will do better.
mm,
But the more drastic weight you reduce, the faster you gain it back again, or the faster you are destroying the metabolism of the body. I would strictly
mm,
say no for a drastic reduction of the body weight. And especially if the body weight reduces more than 10% of the body weight. For example, if a person is 60 kgs in
mm,
weight, and then we are planning to reduce 6 kgs in a month,
mm, mm,
I would call that to be a drastic event, and that might not do any good to him. That may
mm,
he may feel like he would have become light after 1 month after reduction of, but drastic changes, and those changes might have a effect on the heart, or well, on the kidneys itself,
mm.
causing damage, and even to the bowel also, if you ask me. So the best approach I would say is, even see, for example, this would especially be useful to the diabetics or many people. If you ask me, 1 kg per month reduction is better, and 12 kgs per an year is far better, and this requires a lot of discipline too.
Right, right.
More than that.
Consistency is the game. Uh,
Hmm.
yeah, yeah. If you're
This,
talking
this
specifically
height,
about weight loss, hydration is very much important. But
yes.
again, consistently maintaining that throughout your life becomes a bigger challenge. Most of us, we think that अरे 3 महीना में दुबले हो जाएंगे, अरे 5 महीना में दुबले हो जाएंगे, उसके बाद तो उसको मेंटेन करना है. No, no, no. You have to maintain it forever. You have to create a habit out of it if you're losing weight, and you cannot just rely on water. Water is important, but apart from that, yes, doctor, you want to say something?
नहीं नहीं, सुनने के लिए बहुत अच्छी लगती हैं चीजें, बट फैंसी थिंग्स
Right,
फैंसी ही होती हैं, बट मेंटेन करना
right.
काफी मुश्किल हो जाता है, एंड इट्स नॉट रॉन्ग इन
Mm-hmm.
दैट हम लोग मेंटेन नहीं कर सकते, बट डिसिप्लिन मेंटेन करना मुश्किल हो जाता है. To
Mm-hmm.
maintain a
Right,
discipline throughout, that's not the way, that is not the human psychology per se.
right, right, right. So
But yes,
we
you
we
can
love treating ourselves at times with some good
yes,
food and
yes.
of course sweets. We cannot avoid that. But tell us, what is the role of diet in OAB, doctor? Any sort of particular diet which one should follow? Any do's and don'ts?
Yes, if you ask me, in the diet there must be no dehydration. First thing,
Hmm.
diet with dehydration, and the second thing is that the excess of salt will beget excess of urination. So I would
Hmm.
like the viewers to say that excess of salt avoidance is very good. As you age, salt avoidance might actually do good. Maybe not to all people, but yes, but to those patients who are cardiac patients, then who are prostate patients, who are diabetics, so that their over excessive urination can be stopped, or assessment can be done. And the second thing is very, very, very important. The elderly gentlemen after 60, of course, women too. So
Hmm.
after the age of 60, one third of urine output especially comes at night. So
Right.
my advice to the elderly people, especially after 60s, is that because one third of the urine output बिना पूछे ही रात में आता है, सो
Hmm.
और ज्यादा पी के ज्यादा पेशाब रात में जाए और नींद खराब करें, दैट इज अ रॉन्ग थिंग. यू
Hmm.
डोंट नीड रिक्वायर्ड टू डू दैट. इसीलिए मेरी माने तो शाम 5 बजे के बाद थोड़ा सा लिक्विड कंटेंट कम करना चाहिए. सुबह में
Hmm.
जितने भी पिए, जैसा मैंने कहा कि 2.5 लीटर तक मिनिमम पीना चाहिए, शाम में कम कर ले और सुबह में ज़्यादा करें, सो दैट रात में न उठें और नींद आए, बहुत बढ़िया. बिकॉज 70-80 साल के बाद यूजुअली रात में नींद नहीं आता उन लोगों का। ब्रेन का प्रोसेसिंग लेवल इतना ज़्यादा होता है कि सोते नहीं हैं। और
Hmm.
ये मोबाइल के ज़माने में वैसे भी नहीं सोते, फिर भी
बिल्कुल.
तो रात में ज़्यादा नींद नहीं आता है, देन द
Hmm.
सर्केडियन रिदम ऑफ द ब्रेन इज़ लॉस्ट। तो
Hmm. Hmm.
उससे भी ओवर एक्टिव ब्लैडर हो सकता है। And
Right.
I just saw a question actually coming down. Someone asked me about OAB in pregnancy. That practically cannot be called OAB in pregnancy because the pregnancy में क्या होता है, बेबी का जो सर होता है, that usually bladder neck के ऊपर वो compression करता है। See, for example, if this is the bladder and the head goes on compressing, so pregnancy में इसीलिए औरतों को जैसे ही प्रेगनेंसी बढ़ता जाता है थर्ड ट्रिमेस्टर के बाद, यूजुअली आफ्टर 6 मंथ्स, तो उनको ज्यादा ज्यादा पेशाब आता है। दैट इज बिकॉज ब्लैडर, इफ द ब्लैडर कैपेसिटी इज दिस मच, द बेबी इज गो ऑन कंप्रेसिंग, सो ब्लैडर का कैपेसिटी छोटा होता है, तो इसीलिए ज्यादा पेशाब जाते हैं। एंड
Hmm.
ऑफ कोर्स अगर सच में तकलीफ हो रहा है, उनको फीवर हो रहा है, यूरिन में जलन हो रहा है, कभी ब्लड हो रहा है, या प्रेगनेंसी में पहले ही कोई पत्थर था, इफ देर वॉज अ स्टोन बिफोर इट सेल्फ इन द बिफोर द प्रेगनेंसी, or if the doctor is anticipating any infection to the kidney, yes, well, you should go to a urologist and have it checked out, because in the recent past we have been treating a lot of pregnant patients with stones and pyelonephritis and infections coming to the hospital and clinics, where practicality is that we cannot treat stone when the patient goes after second or third trimester of pregnancy, especially after fifth 6 month we cannot do anything. And if that will be a practical trouble.
Right. Now, when we're talking about hydration or liquid intake, sorry, let me tell you, tea and coffee is also included in that. We love our teas, we love our coffees, especially the age group which we are talking about. They are mostly idle, and the only thing which we do when we are idle is drink our tea or coffee, or we'll
You are
go
being
and sit
very
with
modest
someone, chit
now.
chat.
You
Yeah,
are
it
practically
can be
being very, very modest now. चाय कॉफी की
but
बात हो
but
जाए।
but talking to someone, standing on the road, feeling bored, feeling sleepy, solution to everything is tea or coffee.
Yeah,
So,
yeah,
what is the
yes.
right time to have tea? How many cups to have? And should we avoid a little?
The practicality is that the 2 cups is fair enough. Okay, or a cup early in the morning is actually morning is better. And to practically to reduce the gastric trouble or gastritis, if you ask me, I would advise that every fourth hourly, because the acid is produced in the stomach, there must be something in the stomach. And the timing of 8, 12, 4, and 8 hands stand still good. 8 o'clock, 12,
Mm,
12 noon, and 4 baje or 8 baje. This is the time when you need to have something in the stomach, so that when the gastric acid is produced, ओके,
mm,
एंड देन वही टाइम पे कुछ खाएं तो गैस्ट्रिक ट्रबल भी चला जाएगा। एंड रही चाय की बात, सुबह एक बार शाम एक बार हो जाए तो बहुत बढ़िया। बट मेरा एडवाइस है भाई साहब कि शाम में अगर चाय कॉफी बंद कर दें बुजुर्ग लोग, तो रात में ज्यादा नहीं जाएंगे, बिकॉज जितना आप चाय
right,
पियोगे उतना आप यू विल गो टू वॉशरूम। if that is a troublesome thing, yes, I would advise the gentlemen or women to please meet urologist.
right. Doctor, why do we get to see this condition mostly in the women? What is the reason behind it?
Yeah, ma'am, practically speaking, अभी यू देर आर सर्टन anatomical things, ये बहुत बड़ी बात नहीं है, बट हाँ, yes, this is a medical thing। पता होना चाहिए कि फर्स्ट इन अ वुमेन you will have a bladder, then uterus behind, and the feces bag behind, rectum.
Mm,
So step by step पहले bladder होता है, उसके पीछे uterus होता है, and then we have the feces bag or a rectum. Now, when the female, because practically because sexual activity होता है और active sexual activity होने से the chances of infection increases in a female. But female, the advantage in a female is that urine infections are two types. One is complicated and the other is uncomplicated.
mm,
Uncomplicated urine infection can be is very simple one, and it can be treated for 3 days and it will be over. Usually it will be
Hmm.
so. But complicated infections do come for people with comorbidities or recurrent यूरिन इन्फेक्शन होता है, कोई एनाटॉमिकल अनोमली होता
Hmm.
है, पत्थर होता है या कुछ और होता है, तो then we'll have complicated UTI. And when there is loss of hormone, especially for a female who is post menopausal, मतलब
Hmm.
महीनावारी खत्म होने के बाद the hormonal ईस्ट्रोजन हार्मोन कम होना शुरू होता है, तो द जो सपोर्ट ऑफ जो यूरिन पाइप का जो सपोर्ट होता है वेजाइना का एंटीरियर वॉल, वो सपोर्ट चला जाता है, दैट इज बिकॉज ऑफ लॉस ऑफ
Hmm.
ईस्ट्रोजन. तो
Hmm. Hmm. Hmm.
इन दैट पर्टिकुलर थिंग ब्लैडर नेक का एंगल चला जाता है और उन लोगों में ज्यादा बहुत अर्ज होता है बार बार जाने का, खांसी करने से पेशाब चला जाता है. And
Right.
more so if the female if she is if she is having chronic cough or a constipation issue, पेट में इतना प्रेशर बढ़ जाता है कि लैक्स वॉल नीचे आ जाना शुरू हो जाता है, ब्लैडर विल ट्राई टू पुश डाउन, द यूट्रस विल ट्राई टू पुश डाउन. This concept is called pelvic organ prolapse.
Right.
Of course, there are many grades of prolapse. We don't need to speak about that. But the
Hmm.
pressure inside the abdomen is the real concept. अब प्रेशर इनसाइड द
Right.
abdomen क्यों आ रहा है, खांसी से आ रहा है, कॉन्स्टिपेशन से आ रहा है, या कोई ऑपरेशन से आ रहा है, या कुछ किसी और से आ रहा है, दैट्स अ डिफरेंट स्टैंडर्ड. तो हार्मोन लॉस इन अ फीमेल मस्ट बी एड्रेस्ड इफ इट इज रियली फेल्ट टू बी नीडेड. सो अगर गायनेकोलॉजिस्ट को लगता है या यूरोलॉजिस्ट को या यूरो गायनेकोलॉजिस्ट को लगता है कि भाई साहब ये हार्मोनल लॉस की वजह से हो रहा है, तो देन हार्मोन रिप्लेसमेंट थेरेपी होता है, इट इज प्रेटी मच रिक्वायर्ड. And those females with then another scenario is for females whose uterus has been removed because of some reason. When uterus has been removed because of some reason, of course the anterior wall may not give that support as it gives to normal women. The support of the urethra becomes low, obviously low. And as you age, the laxity of the muscle and pressure inside the abdomen because of constipation and cough increases much more. So these
Hmm.
are all the things usually females do face. But
Right.
now that the education system is very high and social, everyone is now a social, क्या बोलते हैं,
Hmm. Hmm.
everyone
Hmm.
Facebook and social phenomena are so high. I don't think any
Right.
female will sit in the house, who has some this urinary issues or incontinence issues and all
Hmm.
this.
Hmm. Hmm.
So
But
I think, हाँ जी.
yes, but there are women who are still suffering from UTI, and they are not talking about it. Maybe they are not treating it, maybe because of carelessness, or because maybe their work is such that they cannot use the toilets frequently, so holding the urine for a long time, uh, not able to hydrate yourself frequently, these are the major reasons for having UTI, and it is so much commonly seen amongst us. um, I mean, we are facing the issue on a daily basis, and we are not talking about it. Maybe we are not able to identify the condition, or we don't know whom to visit for it. Basically we are not talking about it. We are just thinking कि कुछ तो प्रॉब्लम हो रहा है जो अपने आप ठीक हो जाएगा, बट ये अपने आप ठीक होने वाला चीज है नहीं. You have to take care of it. Doctor, are there any things, any food items which can help the condition get a little better?
Yes, see, uh, as simple as that, if there is a urine infection, and if the cause of the urine infection, root cause is could be found out by doing a urine culture,
Hmm.
okay, then, and if we can remove the urine culture by adding these alkaline things, for example, all the fruits or citrus fruits are alkaline in nature.
Hmm.
इसका सिंपल फंडा है, बड़ा कोई फंडा नहीं है. यूरिन इज एन एसिड बेसिकली. सो अभी एसिड मीडियम में कोई इन्फेक्ट हो रहा है एंड वी आर एडिंग न्यू अल्कलाइनिटी, लाइक अल्कलाइन सिट्रेट का सॉल्यूशन देते हैं या फ्रूट्स खाते हैं ताकि यूरिन का अल्कलाइनिटी बढ़ाएं, तो if the bacteria ceases to survive or it dies, then the UTI will practically vanish. So the इसीलिए fruits are meant to be very good sources, and
Hmm.
Especially, some people, we have a lot of cranberry extracts now.
Right.
And apart from that, simple hydration will do a lot of answer. Jitna hum pani
Right.
piyenge, and if we start to throw out the urine inside the bladder, the urine also will get washed off. And
Hmm.
if the
Hmm.
urine
Hmm.
is practically getting infected, we better do a urine culture, find out the organism, and get it treated appropriately so that the
Right. Right.
infection does not prolong.
Hmm. 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 Right.
And
Right.
we better identify it faster. And if you are having simple concept, burning urination, going urination more than required, urgency, jalan ho raha hai, blood in the urination, then
Hmm.
I would ask anyone, be it a child, be it an adult, be it a elderly gentleman or a woman, please consider going to a urologist because he would help you.
Right. And let me tell you, treating uh, urine infection or UTI in the initial stage is very easy. Also,
Yes.
it does not take much time. So, why trouble yourself without not treating it and prolonging it for a long time? It will increase the suffering for you. It will also be a harassment on the part of your doctor. So, do not prolong the condition. It is easily treatable, it can be pain free if you identify the condition in the initial stage. Um,
Yes.
Doctor, speaking of it, I can see a few questions coming up from the viewers. But before
Please.
that, because it is a kind of infection which we are talking about, and infections are normally contagious. So, is UTI contagious as well?
Yeah, that's what I'm asking. UTIs are not contagious. If it is a sexual
Hmm.
disease, yes, it is a contagious one.
Right, right.
And
So, we
remember,
will quickly,
there
yes,
is
please.
another important thing to be told. Urine
Hmm.
infections do come more in females because of lack of immunity also.
Hmm.
तो इम्यूनिटी को भी
Right,
बढ़ाना चाहिए, विटामिन डेफिशिएंसी होता है, थायराइड पेशेंट होते हैं,
right.
हाइपोथायरॉयडिज्म होता है, सो मेनी थिंग्स कम इनटू द सिनेरियो. सिंपल
Hmm.
इश्यू,
Hmm. Hmm.
यूरिन यूरिन इन्फेक्शन हो गया, पहले डॉक्टर के पास जाओ, कल्चर कराओ, फाइंड आउट द ऑर्गेनिज्म, गेट ट्रीटेड, खत्म.
Hmm.
But
Right.
sometimes what happens, these things go on, and it
Hmm.
depends on the educational qualification upon the patient also, saying that, well,
Hmm.
if the treatment is required for a 5 to 10 days or more than that, sometimes some patients, the economy of the patient affordability, and also patient को सुनना चाहिए, patient को उनको बरकत रखना चाहिए. He has to take the, and he has to take the tablets, and then everything will matter.
Right. Now,
But
Doctor, let's quickly attend few of the questions which are coming from the viewers. The first question comes from Ajit Singh, who asks, "Can OAB be a sign of other bladder disorders?"
yes, OAB can be a sign of bladder disorder, saying that it is a prostate, bladder kharab ho gaya, and it is a sign of bladder over functioning bladder. For example, अगर prostate patient होता है 50-60 years के बाद, bladder का capacity 400-500 ml हो जाता है, but prostate, which is sitting at the neck of the bladder, it is obstructing and seeing that the thing is closed, and bladder is unable to throw, and so the bladder size increase हो जाता है, so the bladder will try to push away the urine from the creeks of the prostate increase. That is called overflow incontinence. Or in cases of prostate cancer also, in some people there can be overactive bladder also, उनको बार बार आता है, तो इसीलिए डॉक्टर को जाके दिखाने की जरूरत पड़ती है. तो पेशाब रुक जाता है, तो इन्फेक्ट हो सकता है. इन्फेक्टेड ब्लैडर सोचेगा कि इन्फेक्शन को निकालना चाहिए, तो ब्लैडर बार बार मारने की, और ब्लैडर बार बार पेशाब थ्रो करने का कोशिश करेगा. सो दिस हैज टू बी टेकन इनटू कंसिडरेशन.
Right.
एंड
And
फॉर
Doctor, what is
एग्जांपल,
the yes,
if
please.
there is हेमेच्यूरिया, यूरिन में ब्लड होता है, तो
Hmm.
ब्लड इज वेरी गुड ओनली इन द ब्लड वेसल, ब्लड कहीं भी बाहर हो इज नॉट गुड. सो ब्लैडर में अगर
Hmm.
ब्लड होता है, तो यू ब्लैडर विल स्टार्ट टू थिंक ऑफ इट एज अ फॉरेन मटेरियल, एंड इट वांट्स टू थ्रो ऑफ.
Hmm.
सो
Hmm. Hmm.
इसीलिए जिस पेशेंट को यूरिन में ब्लड आता है, उनको बार बार पेशाब आता है, बिकॉज ब्लैडर वांट्स टू थ्रो अवे व्हाट इज नॉट यूरिन. It thinks that it
Hmm.
is something else. So that is why any new thing, any abnormal thing, it is better that we consider showing a doctor.
Right. Uh, right. Doctor, let's quickly go through the next question. Comes from Abhishek. Uh,
हाँ जी.
who asks, can you manage OAB while traveling?
Yes, why not? OAB while traveling can be managed by drinking water in appropriate quantities, and also according to, as simple as that, sir. It depends on your affordability. बस से जा रहे हो कम पानी पी लेना, कार से जा रहे हो अपनी मर्जी से पी लेना, रोक लेना. ट्रेन से जा रहे हो तो कोई तकलीफ है ही नहीं, ट्रेन और प्लेन से जा रहे हो. बट द ओवरऑल थिंग इज दैट इफ यू आर ऑलरेडी हैविंग अ डिजीज beneath, then you need to consider yourself drinking water in an appropriate quantity and emptying the bladder accordingly.
Right.
This is the best way
Doctor,
of it.
what, yes, as I was saying, what is the rate of recurrence after being treated?
वही बोल रहा हूँ ना मैडम जी. सी, it is not rate of recurrence. The better way to question is this overactive bladder be cured, and
Hmm.
will this come again? Because this is not, there is nothing called rate of recurrence particular per se. This is not one disease. There are so many reasons for overactive bladder. If you remove the reason, yes, we can control the disease. Apart from that, मैंने पहले ही बोला था कि there is something called bladder diary, and we practically have to control the bladder, and we train the bladder to pass for every 3 hourly. For example, if a patient comes saying that, sir, I have been having this disease in 6 months or 1 year, and I'm passing 18 to 20 times per day. Practically, he is having no sleep, he cannot do work, neither he can have sexual activity nor he can live his good life. His quality, dailies both are lost, quality of life is lost. Up when he is passing an hourly or 50, every half an hour, I cannot stop the bladder entirely. So I need to find the source of it, remove the infection, the root cause, like root cause analysis, you can say, and then we train the bladder to pass the urine up to, पहले 1 घंटे से लाए उसको 2 घंटा, 2 घंटे से लाए 3 घंटा, बिकॉज नॉर्मल वर्जन 3 घंटा होता है. तो उसको
Hmm.
2.5 घंटे से लेके 3 घंटे तक अगर रुका सकते हैं उसका ब्लैडर को, even with a drug or with an appropriate treatment, that is fair enough. That is how we can treat.
Right.
ब्लैडर डायरी
And
बहुत
what
ही
if, right? And what if, doctor, somebody is not treating it for a long time and just avoiding all the symptoms and prolonging the condition? What can be the worst case scenario of it?
इधर पेशाब रुक जाएगा. ओके, दैट इज वन वे. रिटेंशन में चला जाएगा and bladder muscle will be lost and bladder will become so big, and
Hmm.
the patient might not might land up ending retention. That is the one way, or will end up in incontinence. And retention is very common than incontinence in elderly people, because bladder का muscle will start to grow. कैसा ग्रो होता है कि ब्लैडर मसल के बीच में जो स्पेसेस आते हैं, इट विल स्टार्ट टू डेवलप सैक्यूल सॉर्ट ऑफ ए थिंग. सो इट इज लाइक you have a balloon, and then you compress the balloon, another bubble will come. सो
Hmm.
ब्लैडर के आजू बाजू भी छोटे 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 बबल्स आ जाते हैं. दैट इज कॉल्ड, सो डाइवर्टिक्यूले हो जाते हैं, दैट दे विल स्टार्ट टू स्टोर द यूरिनेशन, एंड दे बिकम ह्यूज एनफ, एंड द ब्लैडर काम करना सीज कर देता है. तो ज्यादा पेशाब बच जाएगा, इतना बच जाएगा कि पेशाब नीचे नहीं जाता है, ऊपर जाता है, और दोनों किडनी फूल जाते हैं. दिस इज कॉल्ड बाइलेटरल
Hmm.
हाइड्रोनेफ्रोस, एंड किडनी फंक्शन में भी एट प्रॉब्लम. So
Hmm.
these are all the things to be taken care of and considered. इसीलिए जब ओवर एक्टिव ब्लैडर पेशेंट आता है तो उसको ट्रीट करते हैं, और अंडरलाइन कॉज में एक छोटा सा अल्ट्रासाउंड करवा देते हैं, तो समझ में आता है कि क्या चाह रहा है, ब्लैडर कैसा है, ब्लैडर मसल कैसा है, ब्लैडर वॉल थिकनेस कितना है, किडनी कैसा है, यूरेटर्स कैसे हैं, सब पता चलता है. अगर पता नहीं चलता है, या देन वी नीड टू evaluate the patient. This evaluation is not simple, but we can, if you stick on to the plan, yes, it is so.
Right. And with that, I think this answer already answers the last question, which came from Arvindra, who asked, "Can OAB lead to kidney problems if left untreated?" Yes,
Yes.
doctor has already mentioned it. Right. And
Yes.
with that, doctor, this was the last question for today's session. It was a very informative and very interesting session today. Before we take a leave, any take-home message for our viewers who has watched us so far?
Simple. Adequate hydration, one, both for males and females. And दूसरी बात, if you are having any symptom of urinary infection, especially an urgency, burning urination, passing more times in night, प्लीज डू नॉट टेक इट इन अदर वे, बट डो नॉट उसको केयरलेस मत कीजिएगा। यूरोलॉजिस्ट के पास जाइए, छोटा सा यूरिन एग्जामिनेशन और कल्चर में आपका प्रॉब्लम पता चल जाएगा, भले एक अल्ट्रासाउंड हो जाए, बट दैट इज दी वे। एंड द सेकेंड थिंग इज दैट गुड डाइट, and if you ask me, a balanced diet, good exercise, good amount of hydration, and appropriate health checkups as needed, that will do all the job. And maintaining immunity, these will do the job. And plenty of water saves our kidney.
Right. Well, that was the expert advice for today, and that was Dr. Krishna Karthik for us. Thank you so much, Doctor, for your valuable time. It was quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Nice day.